What if I told you a man's shadow saved thousands of lives, but he died believing he'd failed? In 1918, a Japanese bacteriologist named Masanao Gotō arrived in Harbin, Manchuria. The pneumonic plague was spreading through the frozen city like wildfire. People collapsed in the streets. Families locked themselves indoors. The death toll climbed daily. The Japanese military wanted fast answers. Gotō had something different: obsession with detail. Most doctors treated plague patients the same way. Gotō photographed everything. He documented infection patterns on maps. He marked which streets had cases, which buildings, which families, which individuals within those families. He noticed something nobody else bothered to see. The plague wasn't random. It moved in lines. It jumped at specific points. It stopped at certain boundaries. He became convinced that isolation, true, brutal isolation, could break the chain. Gotō proposed something radical: quarantine entire neighborhoods. Not just sick people, everyone. Lock them in, post armed guards. Allow no one in or out. No exceptions. No mercy. The military hated it. It meant economic collapse. It meant stopping trains. It meant families torn apart for weeks. But Gotō didn't care about comfort. He cared about numbers. He implemented the cordons anyway. What happened next was almost miraculous. Cases stopped appearing. Deaths declined. Within weeks, the plague halted completely. Harbin survived. Thousands lived because one man saw patterns others couldn't. But here's the cruel part: Gotō never knew he was right. He died in 1933, 15 years later, believing his methods were controversial. The Japanese medical establishment hadn't celebrated him. They'd resisted him. He spent his final years publishing papers nobody read, making observations nobody believed, fighting a system that saw him as obsessive and rigid. It wasn't until decades after his death, after epidemiology became a proper science, that researchers look back at Harbin's records. They realized Gotō had invented data-driven disease control. He'd created modern quarantine protocols. He'd proven that isolation, tracked meticulously, stops pandemics. But he died thinking he'd failed. His methods became foundational to global health. His isolation strategies saved millions during COVID. His maps became the template for disease tracking everywhere. History forgot to tell him while he was alive. Do you think he would have changed anything, knowing the truth? Or would he have remained exactly the same, obsessed with numbers while the world caught up?